morning, everyone. Today we have Chris with us in the chair.
Right?
We'll be targeting for Chris roughly around 2,700, 25 to 2,700 grafts to reinforce his zone 1 and zone 2. First 2 centimeters, the following 5. We're going to keep a higher hairline per Chris. Nothing that's going to change his look drastically, just reinforce what he has. So more of a higher hairline, more of a European type versus, for example, Mediterranean type of a hairline. Okay. So what we're going to do now is we're going to start the harvesting phase. So in order to do that, we're going to have to clip the donor region first. Okay? All right.
First time shaving my head, so.
And this was your first time dyeing your hair as well?
Yeah. And I didn't do too great of a job, but.
Looks great.
Thank you.
And you said you colored it black, right?
I did.
Came out more like on the dark brown. All right. Your hair texture is nice, fine and thin. All right. Look straight ahead for me.
Okay.
There we go. When was the last time you had your head shaved?
Never.
Never?
Yeah.
First time for everything.
Yeah.
Look straight ahead for me a bit. What we're going to do is we're going to keep the hairs on top long for now.
Okay.
And we're just going to clip the donor region, okay?
Okay.
Oh, you missed the spot.
I did?
Yes.
Uh-oh.
Seems like you have a little bit of a dermatitis.
Yeah, when I put it on the back, it kind of burned a little bit.
Get it?
Yeah.
Skin's a little bit irritated. How long did you keep it on for?
I just did the 20 minutes that they said.
I see. Bring your chin down.
Is that going to affect anything, or?
We'll take a look right now. Yeah. Look straight ahead. What we're going to do next, Chris, is we're going to outline the donor using just a regular marker. What we're doing is we're outlining it so we make a grid.
Okay.
And we want to have equal size square boxes in the grid. So when we harvest for 2,500, everything comes out nice and even. So we take out the same number of grafts per square. We usually go a little bit less on the temples. Usually the temples are more see-through.
Okay.
But we'll make up for the difference in the back.
Okay.
Bring your chin down a bit. I'm glad you colored your hair, just because with the hair dye, it's seeing the grafts just barely, and if it was your natural color, it would have been much more challenging to pick the quality graft. So anytime clients have fine, thin hair, light colored hair, blonde, light brown over white skin, it's always a good idea just to dye it so we get to have a better visual. Alrighty. What we're going to do next is we're going to disinfect, okay? You're going to feel something cold.
Okay.
We're going to clean this region.
Okay.
Right here. Thank you. By the way, guys, this is our new YouTube channel. We started a new one. We changed the clinic name to FUE Hair Clinic. So if you did subscribe, feel free to resubscribe to our new channel. Give us a thumbs up. Sounded cheesy, huh? Alright. If I could please have a tricons, thank you. mouse, please. Alright, Chris, what we did is we clipped the donor region, we disinfected it, we made a nice grid. We ended up with 21 squares, so what we're going to do is we're going to harvest equal number of grafts from each square. So once everything grows out, everything looks nice and even, we're going to go a little bit lower on the temples just because that naturally is on the thinner side. So you're going to feel a little vibration device on the neck, okay?
Okay.
That's to distract what we're about to do next, which is the numbing,
Okay.
right temple, and then the left temple.
Okay.
This is the most sensitive part for this
Okay.
phase. If you could tolerate 4 or 5 seconds, the rest is very super duper easy.
All right.
Okay. Thank you. Take a deep breath for me. Inhale, exhale. One more time, inhale and exhale. On the count of 3, here we go.
All right.
1, 2,
Okay.
and 3. Sorry, almost done. 3, 2, and 1. You did it. Good job. How bad was that?
Not too bad.
Good.
You can, yeah.
There we go. 1, 2, 3. This is the worst part.
Okay.
Most sensitive, and you're almost done. 3, 2, and 1. Beautiful.
All right.
You did fantastic. So we're gonna get you a quick juice.
All right. Juice reward.
Juice reward, some brownie points. Alright. What we
Thank
did
you.
on the right, we have to do the same
Okay.
on the left. Left side is much smaller, okay?
Okay.
There we go. Take a deep breath. 1, 2, 3. Almost done. You're doing fantastic. 3, 2, and 1. You did it. And now top portion. Here
Okay.
we go. 1, 2, 3. Almost done. 3, 2, and 1. You did it. Good job. All done.
That's the hardest part.
That's the hardest part, Chris.
Alright.
And you didn't last more than 5 seconds.
Alright.
Chris, one thing I want to let you know,
Okay.
this numbing medication has a single drop of adrenaline inside,
Okay.
also known as FUE. Why do we use it? So
Okay.
you don't bleed as much during the
Okay.
procedure. It constricts the blood vessels. But what happens in return is patients say, oh my goodness, I feel that my heart is beating a little bit more forcefully.
Okay.
That's because of the blood vessels being constricted.
Okay.
The heart works a little bit harder to pump the same amount of blood volume.
Okay.
So if that does happen, it's not you feeling nervous or anxiety, it
Okay.
is the medication.
Okay.
It lasts about 20 minutes.
Okay.
But your heart rate is amazing. It's in the 70s. So
Okay.
usually it's high 90s, around 100 with the adrenaline.
Okay.
It's like you working out, but you're in
Okay.
good shape.
All right. Good. All right. Thank you.
You're welcome. So what we're gonna do now, Chris, is we're going to ask you to stand up and we're gonna
Okay.
get you in position.
Okay.
We're gonna start the harvesting phase, okay?
Okay.
All right. All right, Chris.
All right.
We finished the harvesting phase.
Okay.
How bad was that for you?
Not too bad at all.
It was bearable?
Yeah.
All
I
right.
didn't even feel it.
Oh, good. Awesome. Just a few seconds of pokes, right?
Yeah.
After that, clients don't typically feel much.
Yeah.
So I believe we have over 2,700 grafts for
Wow,
you.
okay.
We were aiming as little as 25, but I preferred 2,700 just because your hair was on the finer, the thinner side. So hopefully we could pack it in a little bit more so you get that extra density due to your hair texture. Floor, how many grafts did we end up with? What's the final count and what are the percentages, please?
We have 2,737 grafts.
Okay, so 57 over.
So we have singles 524, doubles we have 947, and triples we have 1,266.
Awesome, and what are the percentages?
Singles are 19%, doubles are 35%, and triples are 46%.
Awesome, so you have over 81% doubles and triples. During the consultation, we talked about possibly you may not have enough triples, but I was wrong.
Yeah, okay, that's good.
You proved us wrong, so
Alright.
we have more triples than doubles, which is
Okay.
good. And I think you having to dye your hair also helped us out a
Okay,
bit as
great.
well.
Yeah, awesome.
Alright, so what we're gonna do next is we're going to do the design.
Okay.
We're gonna take a few measurements, Chris,
Okay.
and let's do some options and play around with what's
Okay.
gonna look nice, okay?
Alright, sounds good.
Alright, I'm gonna disinfect the scalp, okay? Look down a bit for me. And we talked about how you don't necessarily really want to change your look, so
Yeah.
we're not gonna go super duper aggressive on you.
Okay.
Just gonna be more conservative and just basically add more volume.
Okay.
So that way people don't really question you, hey, you look different, what'd you get done? Or something that you've never
Yeah.
had before. Alright, Chris,
Okay.
we're gonna take a few measurements,
Alright.
okay? Close your eyes for me.
Okay.
What I'm trying to see is where would be the ideal location for a hairline where your face is broken down to equal balance, okay?
Okay.
So the attention isn't on your forehead or on the chin, more middle of the face center.
Okay.
Raise the eyebrows for me again, and relax it. Alright. So it never seems like that you've had a super duper lower hairline. It's always been on the higher side,
Yeah.
it seems like. And how can we tell? Take a look at this. Hold a mirror for me if you can, Chris. So the best way to tell where your old hairline used to be, very simple trick, lift up your eyebrows. You see this part of the skin that does not wrinkle and versus this part does? The part that wrinkles means you never had hair. The part that doesn't wrinkle means you used to have hair.
Okay.
So ideally, take a look at this. If I measure your chin to eyebrow, you see how you're 14 and a half centimeter, almost 15? Perfect hairline from the eyebrow up would be 7 and a half, which would be right here, okay? But that seems like it'll be too low for you in your case, because not everyone, of course, goes by these formulas.
Yeah.
You've never had it this low, okay?
Yeah.
And how can we tell? Once again, raise the eyebrows. You see that it's on that part that wrinkles. So what we want to do is we want to raise it up a little bit. And what's the benefit? Number one, more natural according to you.
Okay.
And secondarily, the higher you keep a hairline, the more density you get. The lower you keep a hairline, because zone 1 and zone 2 are the first 2 and 5 centimeters, lower you keep it, you get less coverage.
Yeah.
The higher you keep a hairline, that 7 centimeter now goes more further back.
Okay.
Okay, so what we're going to do is we're going to have some fun with the design and see
Okay.
what we come up with.
Alright.
Sounds good?
Yeah.
Alright, Chris. Raise the eyebrows. Relax it. Alright, so I think I like how the right side turned out.
Yeah.
Let's see what we could do with the left. Okay, look down a bit for me. Let's give you some options.
Okay.
Alright. So, Chris, what I'm gonna do is I'm gonna give you the mirror. I have my favorite side.
Okay.
Okay? I
Alright.
want you to see what side
Okay,
you like
okay.
more. You see the difference between the two?
Yeah.
Okay. With the number of grafts we have, you could do the right or you could do the left.
Yeah.
Right side, it's not as aggressive. I mean, compared to the left, it is more aggressive, but in regards to being super duper
Yeah.
aggressive, it's not like
Yeah, yeah.
that. Alcohol, please. So my favorite side, well, I'm gonna ask what your favorite side is first. I have my favorite side. What
I think
side
your
do you
side. I think
like?
your favorite side is the right side.
That's my side.
Yeah. And
And if you look at it, that line is not super low or
Yeah.
you never had it. It's right
Yeah.
actually above it. So you've always had hairs here.
Yeah.
So it's a safe
I'm
side.
leaning more towards the right side as well.
The right side? Okay. Let's take a look. Put the mirror down for a quick second. Look straight ahead at me. Look down. Not so high, not so low. Yeah, I like your right side as well more
Okay.
than the left. I think left is a little bit too mature.
Yeah.
Okay, perfect. Let's make the left look more like your right.
Okay.
Alright.
And you think there's enough hairs there for that?
There should be, yeah.
Okay.
Slightly this way. Alright, Chris,
Okay.
take a look at this. This is
Alright.
what I want you to see.
Okay.
Is I went ahead, I made the left side look as close to the right.
Okay.
But as I was taking the measurements, one thing I noticed is you have more hair loss on the right side
Okay.
than you do on the left. What do I mean? I don't necessarily mean on top of the scalp, more on the temples.
Okay.
So if you look at the center, where that line is to your temple here, you see how it's 8 centimeters?
Yep.
Okay. From here to your temple, you see how you're at 7, 7.25, almost 7.5? So on the right side, you have lost almost half a centimeter to 3/4 of a centimeter more than your left. What does
Okay.
that mean? It just means you have more hair loss on the right. But right now, when I do the design, because this is basically more back, this is more forward, the hairline is going to look a little bit more irregular to your
Okay.
eyes. That's because one side goes further back.
Okay.
Make sense?
Yeah.
So what I'm gonna do is, what side do you like first of all? I went ahead, I tweaked the left side, and what I wanna do is I wanna tweak this right side to make it look more like the left.
Okay.
It's like a hybrid of the first two designs
Yeah.
that we did. It's not as aggressive as the right, but it's also not as high as the initial design.
Yeah.
What do you think?
Mm.
Let me see, look at it straight. I love your, they're very similar.
Yeah.
I think all the right side needs is a little bit of a tweaking.
Okay. So you like this?
I
side?
like the
Yeah.
left, but ultimately I want you to like it.
No, I do too. I kind of like a little more curve because it's kind of what I've always had.
Exactly, and this is the part that I really want to tweak, is this kind of, for me, goes a little bit too straight,
Yeah.
especially considering your ethnic background,
Okay.
an Eastern and Northern European, so I think a little bit of a higher arch,
Yeah.
that kind of blends in more like the left,
Mhm.
is a good idea. And keep in mind, like I said, we don't want them to be identical, okay?
Okay.
And we don't want the line to be perfectly straight, that'll scream artificial.
Okay.
We want them to be irregularly irregular, and the right and the left to look 95 to 97%, but not 100% identical.
Okay.
Anything that's man-made, it's gonna scream artificial,
Okay.
okay?
Yeah, I'm really liking the left.
I really
Okay.
like the left
Okay.
for you as well, and this
Okay.
is the fun part with this stage.
Yeah.
We do it until we get it right, and every time we do it, we get a different design.
Yeah. Okay. So
Alright.
this is me in like 1999, which I was 18. So we're pretty close to that, I think. And then that's kind of the most. I was.
Recent one.
Yeah, that was like 20. No, that
But
was
we can't
27.
even see, we can't see your hairline like that. Yeah.
That would be. I don't know if you can see. That was before I think I started losing it right there.
I see. Okay, so
which
you've
is-
always had that higher
Yeah.
hairline.
Yeah, which I
Okay.
think is we're pretty close there. So.
Good. And like I said, we don't want it to be identical. We want it to be as close to it, but without being 100%.
Okay.
So what I want to do is I want to work on this little corner on that
Okay.
right side
Okay.
to blend in, make it look more like the left. It's pretty close, but we want to make it closer without making it too identical.
Okay.
Okay.
Great.
All right. All right, Chris. I'm just putting the final touches.
Okay.
Turn slightly this way on the hairline. We gave you a few options.
Yeah.
We talked about how your left side, you have more loss than you do on the right. I'm sorry, you have more loss on the right than you
Okay.
do on the left. My right, your
Yeah,
left. So that means no matter how much we try to make the hairline look as similar as possible, there's gonna be some irregularities to it because one side goes back by 1 centimeter and one temple is more forward by 1 centimeter, okay? But let me show you the mirror. Tell me what you think, okay? Not too high, not too
Okay.
low, not too aggressive,
Oh yeah.
more natural. You approve? Do you like
oh
it?
yeah, this is great.
Okay,
I think you nailed it on this one.
good. What we're gonna do is we're still gonna place these softeners in front of this hairline.
Okay.
That's gonna make and give you the illusion that it's nice and irregular.
Okay.
The last thing you want is a perfectly straight hairline,
Okay.
something that the right and the left look identical. We want it to be irregular and asymmetrical.
Okay.
We call it irregularly irregular or jagged.
Alright.
Okay?
It works.
So we're gonna break down your zones now. You approve? You
Okay.
like it
Yeah,
100%?
yeah. Mhm.
I don't want you to just to like it, I want you to love
No,
it.
I love it. I love
You
it.
sure?
Yeah.
Okay.
Yeah.
I like it
Yeah.
too.
Alright, thank you.
You got it. So what we're gonna do next is we're going to break down your zones, okay?
Okay.
Alright. If I could please have your ruler. Alright, look down a bit for me.
Okay.
Alright. So how far back does zone 1 go again? It goes back 2 centimeters. It starts at the point of the hairline, okay? This is where you're gonna get double the density versus zone 2.
Okay.
Zone 2 is the following 5 after zone 1. Now, unfortunately, we cannot do the entire scalp at full natural density from front all the way to the back.
Yeah.
That's because no one has an unlimited donor, but zone 1 is the most important, and
Yeah.
we go with the natural density
Okay.
of at least 70 grafts to 75 grafts per 1 centimeter square, okay?
Okay.
Natural density starts at 70 to 75, as high as 100 per 1 centimeter square. Then your zone 2 actually is not that bad, which is the following 5. And we're going to add that remainder of the grafts
Okay.
in your zone 2 and reinforce. So let's have the mirror. Alright, so take a look at this. Chris, where does zone 1 start? Point of the hairline. How far back does it go? 2 centimeters, okay? So all of your zone 1, do you see this? Needs restoration.
Yeah, there's not much left there.
Not
yeah.
much left. Right side, left side. This alone is going to chew roughly around 22 to 2300 grafts.
Oh, okay.
Just in the first 2 centimeters.
Okay.
The additional 500, 400 that we're gonna have, you see this
Yeah.
corner is the thinnest area,
Okay.
along with this corner of your zone 2.
Okay.
Priority is gonna be this corner, that corner. Anything extra, we're going to go in
Okay.
between the existing hairs.
And you put the 2 and 3s up front then? And the
What
same
we
where
want to
you-
do is we want to use the singles for the hairline.
Okay.
You never ever, Chris, want to have hairs with multiple grafts, I should say, with multiple hairs in it on the
Okay.
hairline. It's going to look pluggy. What
Okay.
you want to do is you want to have 3 to 4 rows of singles for the hairline.
Okay.
Everything else behind it, more hairs per graft, like the triples and the quads, go behind the hairline to give you that full density
Okay.
look. Okay. For you, we have high number of triples, so you should be good.
Okay.
Sounds good?
Yeah.
Ready for the shave?
Alright,
Chris,
awesome.
we're gonna shave the rest of the hairs
Okay.
now, okay? When
Alright.
was the last time you had your head shaved?
Never. Yeah,
Never?
yeah,
First
okay.
time for everything.
Yeah. Okay, here we go.
Ah. Alright, Chris, we're just gonna put the final touches, okay?
Okay.
I just outlined what we agreed upon.
Okay.
I personally like it. I think it suits your facial characteristics. It's not too aggressive and it's also not mature.
Okay.
It's right. I think it's a good balance. Okay. I'll show you the mirror right now after I put the softeners. Let me have a marker. And what I'm going to do now is I'm going to place these softeners in front of the hairline so the hairline does not look perfectly straight. Okay. And have you ever thought about getting a widow's peak? Dr. George brought up a good question if
Okay.
you wanted a widow's peak. or
Yeah,
not.
maybe a little one.
Small one?
Yeah.
Have you ever had one before?
Only from my receding hairline, I think.
But nothing before that.
Yeah.
So these are basically, there's no style to it. You just want to do just these random irregular hairs. Alright, perfect. Let's show you
Okay.
this, and let's go over the plan as well.
Oh wow, let me see my head shape. Okay.
Alright, this is how you
Yeah.
look with your head shape.
Okay, alright.
You want to change your mind?
No.
You want to still go with the
Yeah.
procedure? Okay.
It's a little too Breaking Bad-ish for me, I think.
I've had a client in the past who said, I've never had my head shaved before, but I like it. If I had known, I would have done the procedure. So
Oh,
it was too late. We had the grafts out.
Okay, well, no, I'm
And
looking forward to getting
unfortunately-
my hair back, so
Good.
it's okay.
It's always good to have options. You could shave
Yeah.
it whenever you want once everything grows.
Yeah.
So to go over with you the plan,
Yeah.
this is your zone 1, which is going to chew double the density
Yeah.
compared to
You
your
really
zone
see
2.
it when it's shaved,
You
too.
see it's bare
Yeah.
all skin.
Yeah.
Zone 1 left side. Priority is going to be here on this corner, which I had
Okay.
marked prior me shaving.
Okay.
Same on that left. Anything extra, we're going to go right here in the center.
Great.
You like it?
Yeah.
Do you approve?
Mm-hmm, definitely.
All right.
Awesome.
Awesome, Chris.
Alright.
So technically right now you're halfway through the procedure.
Okay.
How bad has it been?
It's been great.
You've just been sitting, right?
Yeah, I got
Sometimes
great
the back
donuts and
hurts.
everything, yeah.
Krispy Kremes.
Yeah.
All right, Chris. So we're done with the design.
Okay.
You're halfway through the procedure. As you know, the procedure has 4 phases. Harvesting, which is what we had to remove the 27+100 grafts.
Okay.
The design, which was something we just completed.
Yep.
Next is the incisions. This is where we follow your natural angles and directions. So if a client has pre-existing hairs, we follow.
Okay.
If they don't, we have to recreate, okay?
Okay.
So what we're gonna have to do is numb the scalp.
Okay.
How's that done? You're gonna get 2 quick pokes right above the right eyebrow, 2 quick pokes right above the left eyebrow.
Okay.
We're gonna numb the supratrochlear and orbital nerves. This is what gives sensation to majority top of the scalp. By doing 2 here, 2 here, you're not gonna feel majority, most of the injections on top.
Okay.
The area that does not reach it are the corners. So most of the center is gonna be numb. You're gonna feel a few quick pokes, maybe 2-3 seconds here, 2-3 seconds there. The rest is gonna be pain-free.
Okay.
Okay? You could tolerate a very small needle, what they use for Botox. The rest is very super duper straightforward.
All right.
Ready?
Yeah.
Alright, so
Alright, Chris, so what we're doing now is we're
Okay.
disinfecting the eyebrow so we
Okay.
can numb the supratrochlear and the supraorbital nerves. Okay? This is the most sensitive part of this phase,
Okay.
the are tear jerkers, so try to avoid any sudden movements.
Okay.
Okay? And if you can tolerate this, hopefully the rest of the phase will be a breeze for you,
Okay.
okay?
you're gonna also feel a little vibration device
Okay.
on the forehead. That's gonna vibrate here. And the whole point for that is so the mind tries to focus on the vibration versus you having to feel the little injections,
Okay.
okay? Take a deep breath for me. Alright, I'm gonna palpate first. Here we go.
Okay.
1, 2. Okay, here we go. Take a deep breath. Don't make any sudden movements, just like Dr. George said. We don't want this to go anywhere else. Close your eyes for me for a quick second. Here we go. 1, 2, 3. That's it. Super fast. And here comes the second one.
Okay.
Don't move. 1, 2, 3. That's it. All done. Right side is all
Okay.
done. We're gonna give you a quick juice break. Have a sip.
Okay. Thank you.
Alright. What we did on the right, we have to do the
Okay.
same on the left. Go ahead, George.
Ready? You ready?
Yep.
1, 2, 3. 1, 2, 3.
That's it. You did it. Good
All
job.
right.
That was the worst.
Alright.
Alright. What we did on the right, we have to do the same on the left. Now I'm gonna go back in here. It's gonna
Okay.
be completely numb, okay?
Okay.
Chin up towards the ceiling. Push the head as far back as you can. Here we go. Any pain?
No.
Good. Here we go. Second one. Any pain?
No.
Beautiful. Good. Same on the left.
Okay.
Ready?
Yep.
1, 2, 3. Any pain?
Nope.
Very good. 1, 2, 3.
You did it.
Done.
Alright.
So I'm just gonna give you about 2-3 minutes.
Okay.
Allow this to work its way up. you're gonna notice that the forehead feels super duper heavy, like
Yeah.
you're wearing a steel helmet.
Okay.
And this eventually is gonna reach all the way on top, okay?
Okay.
Just relax, catch your breath a bit. This was the worst part, the rest is very easy.
Okay.
That's it.
Alright.
You did good, Chris.
Awesome, thanks.
Be back in 2 minutes.
Okay.
Alright, Chris, how you doing?
Pretty good?
Any pain?
No?
Awesome. So we're basically working on finishing zone 2 right now.
Okay.
We've done over 2,200 grafts, 22 to 2,300 for your zone 1. The additional 5 to 600 we're gonna do zone 2. Okay?
Okay.
We're dividing between the right and the left side, while Floor is doing a PRP for you
Okay.
to expedite healing and recovery and growth, so on and so forth. So the benefit of doing PRP today is it's going to be almost painless because your scalp's already numb.
Okay.
And she doesn't have to poke you because you have the IV line, okay? So that's going to spin for 14, 15 minutes, and right during implantation we're going to start the PRP as well.
Okay.
Introduce that to the scalp. The benefit is quicker recovery, we've seen sooner growth, and it also helps with the survival rate of the grafts as well, so it's very beneficial. Alright, this is looking awesome. Your design came out beautiful,
Alright.
Chris. I love it. And that widow's peak as well. What was the worst part so far, you would say?
Probably just the 2 little pricks by the eye, maybe.
The eyebrows?
Yeah.
Okay. Yeah, those are the most sensitive. But it's super fast, right?
Yeah, real quick. It's over in an instant.
It's 1 second, 2 seconds, and that's it. Awesome. We'll be done in about 5 minutes, Chris.
Okay.
No pain here?
No?
Alrighty, almost done.
Okay.
Alright, Chris, how was lunch?
It was really good.
Lunch was good?
Yep.
What'd you have?
Chicken sandwich, French fries.
Chicken sandwich. Okay,
Yeah.
awesome. So basically you're done with 3 out of the 4 phases. Harvesting's done, design's done, incisions are done. You're left with the last phase, which is the implantation. At this part, there's no injections, there shouldn't be any sensitivity or discomfort. You're gonna watch a movie or 2, next thing you know, we're gonna call it a day, you'll be done, okay?
Okay.
What I'm gonna do now is I'm also gonna do the PRP. Like I said, it's gonna help with the recovery, sooner growth, higher survival rate of the grafts. The benefit, your scalp's already numb, you're not gonna feel any of the injections
Okay.
either. So it's only gonna be a benefit, plus.
Okay.
You haven't seen it yet, have you?
No.
You're excited, you wanna take a look?
Yeah.
So this is the outline. So there's
Okay.
no grafts in them yet.
Okay.
That's gonna be next, okay?
Okay.
Can I please have the mirror? Alright, Chris, I hope you like it, cause there's no going back.
Okay.
Alright? We spent a good amount
We
of time
did.
on the design.
Yeah, we did.
So I wanna make sure you like this, and you wanted a small, subtle widow's peak.
Yep. Wow.
What do you think?
Looks
It's
good.
swollen right now, Chris,
Yeah.
okay? Everything is swollen. This is gonna come down next few days.
Okay.
But it's not too straight and it's not too high up.
Yeah.
Okay? So we brought the hairline and we dropped it and we connected it to your side temple. What you don't want is something that just goes like that.
Okay.
You want that facial framing so you get that side profile. Okay? This
Alright.
zone 1, which is the first 2 centimeters, is double the density compared to your zone 2.
Okay.
We also had some extra grafts, about 150. We went and future-proofed the middle. This was the strongest for you. But we did the corners of zone 2 as well.
Okay.
Nice and full. Okay?
Great.
You like it?
Yeah.
Alright. Another 1.5 hours to 2 hours and you'll be done.
Okay, sounds good.
Sounds good?
Yeah.
Alright, we're gonna do the PRP next.
Okay, awesome.
You got it, Chris?
Alright, Chris, so we're gonna do the PRP now.
Alright.
Like we
You should
discussed
not feel a
earlier.
thing,
Yeah,
okay?
you shouldn't feel a thing. This area should be nice and numb still.
Okay.
And like we said earlier, you should have some quicker recovery as well as a higher survival rate of the grafts, as well as some sooner growth, okay?
Alright.
And also helps minimize the chances of getting shock loss. Can I get the gauze, please?
Ready, my friend?
Alright.
Alright, Chris,
Here
here
we
we go.
go.
Okay.
Any discomfort while I do this?
No, don't even feel it.
Very good.
So this is gonna really benefit you, Chris. It's really gonna
Okay.
help. His skin is so well, barely has any bruising.
It's great skin.
I wish everyone had this. Oh, it's on your body, how it takes, how it accepts the grafts and how you take care of it.
Yeah.
Okay, we tell every client, Chris, it's 50% what we do,
Okay.
and it's 50% what you do after you leave to achieve that 100% outcome, okay?
Okay.
Still no discomfort, right, Chris?
Yep. I don't even
So-
feel anything.
Last one. We're almost done.
Okay.
All right. All done, my friend.
All right.
Not
All
so
right.
bad, right?
No?
Very good.
Alright, Chris, what we're gonna do next is we're gonna go over the distribution, okay?
Okay.
The plan, so what I'm gonna need is the number of singles, 524, perfect, 947, 1266, so we have almost 1,300 triples, plus the hairline, that's gonna take us about 15 rows back, okay, so all of this is gonna be triples here. Okay, and then these are gonna be singles, the extra singles that we have because the center is the strongest. And then we'll do doubles, 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 doubles here. Okay, and the triples are actually gonna go a little bit more further back, like that, and doubles. All right, all set. And singles for the hairline to look nice and soft and natural. Alright.
I guess it's true what they say about you people. Can't trust a fucking word comes out of your mouth. What's the matter, John Rue? I hurt your feelings. Matter of fact, you did. Now, I know I'm the only black son of bitch you ever conversed with, so I'm gonna cut you some slack. But you got no idea what it's like being a black man facing down America. The only time black folks are safe is when white folks is disarmed. And this letter had the desired effect of disarming white folks. Call it what you want. I call it a dirty fucking trick. You wanna know why I lie about something like that, white man? Got me on that stagecoach thing. Well, I'll tell you like the good Lord told John. A letter from Abraham Lincoln wouldn't have had that kind of effect on me. I might let a whore piss on it.
I'll spit on it.
Good for you, sister.
Alright, Chris, congrats, buddy.
All right, thank you.
This part's all done.
All right.
How was it?
It was good?
It was good?
Yeah?
Alright, it wasn't
Not
that bad, right?
No, not too painful, not too
Good.
crazy, anything, yeah.
I'm gonna do a quick gentle wash.
Okay.
I'm gonna try to get as much of the dry blood, the scabs, very minimal. Looks amazing.
Okay.
Can't wait for your 6-month progress. You'll be halfway.
Okay.
Overall, how would you rate it? How was the experience? Was it painful? Would you do it again if you had to?
Yeah, definitely. I mean, it was a lot less painful than I expected.
Okay.
I mean, I was kind of scared this morning. I had second thoughts, and then it was just a really great experience. You guys are awesome.
Oh, thank you.
You guys took me right through it, and you guys did an awesome job.
Thanks, Chris.
Thank you.
All right, Chris, we're dabbing the forehead. We're not touching the hairline. No touching for at least 1 month, okay?
Okay.
All right. You haven't seen it yet, have you?
No.
All right. I'm gonna get you the mirror.
Okay.
In a second. I'm gonna adjust the chair. Hopefully I get the buttons right this time. Too many of them. I still haven't seen it, how it looks with the grafts implanted. Look down a bit for me. Look down, chin down. I love it. Looks fantastic. All right, take a look.
Here you go, Chris.
All right.
Whew. You see that?
Yeah.
High density, super packed. You asked for a mild widow's peak. There you go.
Okay.
Okay. And that's where all of your 27, 37, I believe.
Okay.
Over 2,700, under 2,800 grafts. All of this is gonna come down next few days, okay?
Okay.
You're gonna have puffiness of the face, ranging from 3 to 5 days. But I absolutely love it. I think it looks fantastic. It looks amazing.
All right.
It's not too high, not too low. It's exactly what I was looking
yeah,
for.
that's what I was looking for too.
You got it?
Yeah.
All right, awesome.
All right. Thank you.
With pleasure. This is where I go.
All right.
Do you like it or do you love
Yeah,
it?
I love it. Love it.
Chris,
Appreciate it. Thank
it's
you.
awesome having you.
Thank you very much. Appreciate it.
Thank you. Very nice.